Hi everyone, I am Stephanie with Nine Health. We're talking today about flu season 2020, what we can expect, when you should get your flu vaccine. You can ask your questions about the flu vaccine, COVID-19. We're going to try to cover all of it because obviously this year's flu season is a little different with the COVID-19 pandemic. I want to introduce our experts. I have registered pharmacist Nikki Price from Safeway and Albertsons. I have Dr. Emily Cheshire. She's a nurse practitioner and professor from University of Colorado College of Nursing. And Dr. Pal Coley, our Nine Health expert, she's a cardiologist, but also an expert on internal medicine and preventive medicine, can answer all the questions you have. Dr. Coley, I wanted to start with you. First, just give your pitch on why people need to get a flu vaccine, especially this year.
So Stephanie, I call it the 3 S's because this year I think is more important than any other year as we head into what people are calling the twindemic, the culmination of the COVID-19 pandemic and our regular flu season. It could really be disastrous. So 3 S reasons why people need to get the flu shot. So the first S is selfish. So the last thing you want to happen this year is to get COVID and the flu together, or to get the flu and have people think that it's COVID, because it's really going to be disruptive, obviously, to your life and your ability to seek care and to your family and to your community around you. So that's your selfish reason to get the flu shot this year. The other is the selfless reason, which is for the community. So one of the things we want to do is all band together and really get the flu vaccine so that we can decrease the burden on the healthcare system, have less flu illnesses, and the flu illnesses that do occur will tend to be milder so that people are less likely to seek care and the hospitals and healthcare systems can be decompressed to deal with the pandemic that's ongoing. And then the third S is a scientific S. And so this really means that when you get a vaccine, it activates your immune system. So not only are you boosting your immunity to the virus that you're getting a vaccine against, it's a general activation that occurs as well. And it can help protect you against other respiratory viruses as well. So that's a really great reason as well to go and get your flu shot this year. So 3 awesome reasons, and I hope all of us are going to go out and get it.
Yeah, and again, I'm going to look at Facebook for your questions. If you have any questions about the flu vaccine, the COVID-19 pandemic, any other health questions, we can get those answered for you. Dr. Cheshire, when's the best time to get a flu shot? Is now too early? I know last year with Nikki at Safeway and Albertsons, I did a live Facebook Live and I was pregnant and I think I got mine at the end of August. So is it too early right now to get the flu shot, or can people start getting it now?
So now is a great time to get it. There is an optimal time to get the flu shot. Per the CDC, it's recommended by the end of October. And to understand why there's an optimal time, we really need to understand 2 things. We need to understand peak flu season in the United States, and we need to understand how the flu shot works in the body. So first of all, peak flu season, usually December through February. Now we can start seeing flu circulate as early as October, and it can go all the way through May, but we're talking about the peak flu season. So the season where most people are infected and the most hospitalizations is December through February. So knowing that that's peak flu season, and then knowing the other key component is knowing that once you get the vaccine, it takes about 2 weeks for you to mount that immune response. So there's a lag time between getting the flu shot and having immunity to the flu. So that's where that CDC guidance comes in, right? So end of October, 2 weeks of until you've developed immunity, you're well covered before that peak season. Now, I do want to put a caveat. It's not a hard deadline, right? It's not that October 31st and then November 1st, you can't get the flu shot anymore. That's the optimal time to get it. But those folks that do miss out on that October 31st optimal deadline or optimal time are still going to get benefit way after that. Because like I said, we can see flu sometimes all the way into May. So that's why you'll see pharmacies, healthcare providers offering the flu shot well into March. So there is still benefit getting it, even if you don't get that optimal window.
Yeah, and it's, it remains to be seen how things will go this year with COVID-19 and the flu, and kind of it all, both viruses kind of present the same. Nikki, you're with Safeway Albertsons. We're partnering with you guys to provide free flu shots at the handful of 9 health fairs we're able to offer this fall, which is great. So you can get a free flu shot or a voucher at any 9 health fair this fall. Go to 9healthfair.org. We just opened online registration yesterday, and there's, I think, maybe 9 fairs that are open. For those that that don't go out much, maybe they're in a high-risk group, they don't leave their house, do they still really need a flu shot if they never leave home?
Yeah, so they actually still do need a flu shot. They could become exposed to, it could be a delivery driver if they're ordering in, or in many of those places, have contactless but we still recommend that everyone still get a flu shot, even if you're 100% quarantining, just because there may be a family member that you do see that comes in, and though they may be asymptomatic or they're able to beat the flu, you may not. And many of our seniors, those with high risk medical conditions, are doing just that, staying at home. But it's critical that because of they may be exposed to others, such as other family members, it's still very critical that they get a flu shot.
And someone just asked, Shelley asked, has the vaccine changed this year? Can you talk a little bit about whether or not it's changed or if there's different strains?
Sure. So every year the CDC reviews past history, past trends in the United States. They also look to other countries such as Australia that has very similar populations in that to also see what has been trending over there, and they make a decision each year as to what goes into the flu shot. So there is slight changes each year.
And Dr. Coley, Patricia just asked on Facebook, how do we know the difference between the flu and COVID-19 without getting tested? So we kind of talked about the twindemic thing, that anyone that has flu symptoms will kind of be assumed that they have COVID, but can you talk a little bit about that? Is there any difference?
Yeah, unfortunately, there's a ton of overlap in the clinical syndrome. So sometimes people are saying that some studies have suggested that with COVID-19, there might be more involvement of the lungs. So you may have a little more shortness of breath than you tend to have with flu, but they're both systemic illnesses. They're both characterized by fever, muscle aches and pains, fatigue, malaise. They can both have cough as well. So really the only way to know is to get a test for both COVID-19 and the flu. And just last month, the CDC has developed a test, and the FDA has done emergency use authorization for a combo test looking at both influenza A, influenza B, as well as the SARS-CoV-2 virus, which is the virus that causes COVID-19. It's available to a limited number of labs. It's really public health labs. But for most people that present with the syndrome of fever, malaise, cough, maybe shortness of breath, they are probably going to end up getting tested for both the flu and SARS-CoV-2 this season.
And we've talked about another reason, like you mentioned before, to get that flu vaccine so that we're not overwhelming hospitals, doctors with a bunch of cases of flu, thinking it's COVID and not really knowing. Another question I had was, a lot of people say, and I might have gotten into the comments already and I just haven't seen it, but we hear a lot is, I get sick every time after the flu vaccine. Does the flu shot make you sick?
So that is a great question, and the short answer is no. But the more detailed answer is that you can feel some systemic symptoms of kind of feeling run down or feeling under the weather, but that is not from you catching the flu. It is really from your immune system getting activated and fighting, learning how to fight the vaccine, which is the entire point. So, feeling under the weather after the flu shot is not uncommon. It doesn't mean that you've actually caught the flu. Now, it is possible to catch the flu even after you get a flu shot. And that's because of what Nikki just said, which is that really the way that the vaccine is designed is to use our best guess as to what the flu virus is going to do based on demographic trends and based on how its genetic pattern has been changing. But it's always possible that the flu virus could change further, that you had incomplete response to the flu vaccine, or a combination of those two factors leading to incomplete immunity. So it happened to me last season. I get the flu shot every year and I still got the flu. I was positive for it. But the idea is that hopefully the phenotype or the presentation of the flu that you have will be a milder version if you've gotten the flu shot than if you hadn't gotten one at all. Now, there is one small caveat I want to mention is that one of the flu vaccines that's available is called the live attenuated flu vaccine. So most of them are inactivated, so you can't really get sick from the vaccine itself. But the nasal spray, which is the live attenuated vaccine, is available for adults. And that one is giving you a diluted version of the flu. So it is theoretically possible to get sick from the vaccine itself if you actually are exposed to the flu. But again, the phenotype or the presentation is much milder than what you would expect with the full-blown illness.
Yeah, and we'll talk a little bit more about the types with Nikki here in a little bit. But Dr. Cheshire, and someone just brought this up, Melissa said, since we're taking extra precautions to prevent the spread of COVID, won't the same precautions cut down on the spread of the flu? So that was my question to you. When we go out, we wear masks. Do you think that will provide us some extra protection this flu season?
Yes, the short answer of that is yes. Anything that's transmitted through the respiratory tract, which flu, COVID, the rhinovirus, right, the common cold, anything that's transmitted through the respiratory tract, everything we're doing for COVID to prevent COVID should translate to prevention of other respiratory viruses. And Nikki mentioned looking at the Southern Hemisphere for kind of those scientific development of the flu vaccine, where we have to make those modifications on the different strains of flu that we see each year. We also look to the Southern Hemisphere for trends. And interestingly, we're seeing that. We're seeing a lot fewer flu cases, and as a result, a lot fewer deaths from flu. And which is really interesting. That's probably because of the hand hygiene, social distancing, mask wearing, potentially telehealth. We've converted to more of a telehealth medicine model to take care of patients in different ways. Australia also saw 2 million more, they delivered 2 million more flu vaccinations than they had prior years. So that's probably playing a part as well. We certainly hope all of it translates and that we see those same trends this year to ease the burden on, like we've alluded to, the twindemic, ease the burden on the healthcare system and our communities.
Yeah, and I keep saying, you know, it obviously stinks that COVID is here and this has all happened, but maybe it's a lot of things we should have been doing better anyway, washing our hands, staying away from each other a little bit, maybe not wearing masks all the time. But yeah, hopefully all that will help this flu season. Nikki, there are different types of flu vaccines. Can you just tell us what the types are? Is one more effective than the other? I know there's flu mist, and then even, you know, a high dose one for the seniors. And then is there a flu shot for kids available through Safeway Albertsons and the 9 health fairs too? So just talk about the different types that there are out there.
Sure. So the different types outside the flu mist, which is the live vaccine that Dr. Coley mentioned, are really just based on your age. And yeah, really just based on your age. So there is the quadrivalent vaccine, goes under a couple different names, but it's the quadrivalent vaccine, but it's for 6 months up to 64 years of age, has 4 different types of viruses in it. You mentioned the senior dose, so those are geriatrics that are over 65. There's a senior dose that has an adjuvant that, you know, for lack of better terminology for our viewers, stronger to help with immune systems for our elderly who, as you get older, your immune system starts to wane a bit. And so by having that high dose, that certainly helps boost that for to prevent the flu. And then there's also one other one. It's also for 18 to 64 years of age. It's called Flu Block, but it really has a great response in those patients that are 50 to 64 years of age. Again, it has an adjuvant in there to help boost that immunity with that. All of those are available at the 9 health fairs. The only one that we don't have is the flu mist, the live vaccine. And again, that is one that you can get the flu potentially from, or a mild version of it.
And I wanted to, just out of my own curiosity, so when you go to, say you go to a Safeway Albertsons or to see a pharmacist to get your flu shot, I don't ever remember, you know, kind of picking the one I want. Does the pharmacist kind of just decide for you, or do you normally present different types to people?
The pharmacist usually picks for you based on your age. So one of the things as you fill out your consent release form, we ask for your date of birth, if you've had any reactions in the past to a flu shot or any other vaccinations, allergies, things of that nature. And so then we can help best determine which flu shot's going to be best for you and protect you most.
Yeah, I was just curious. I'm like, I've never picked out my flu shot or picked a different type. I know you can like do the flu mist and ask for that kind of thing, but yeah, I wasn't sure. Dr. Coley, someone just asked, Diana said, my son is a type 1 diabetic. He'll be getting the flu shot and the pneumonia shot. We don't have a COVID-19 vaccine yet, but will having both of those benefit him if he does get sick with COVID?
So we don't know directly because there's no direct scientific evidence about that. But based on what we know about other respiratory viruses, we do know that getting immunizations boosts your immune system, boosts the arm of your immune system called the innate immune system. So it just kind of revs up things, and it helps with other respiratory infections, such as the ones that Emily mentioned. So certainly having vaccinations doesn't just help for the organism that you're being vaccinated against. It kind of helps your immune system stay in shape, so to speak, so that it's better able to fight other things. But specifically for COVID-19, we don't yet have data about whether the flu vaccine offers any protection against COVID-19.
And the other question I had for you, we kind of already talked about, I don't know if you want to add to it all, or if people have joined us late, maybe address it again, but will anyone that gets the flu be treated like they have COVID this flu season?
100% yes. And that's, you know, not just in the hospital, but also in your community, from work, missed time seeing friends and seeing family. So it's really, really important that you really help us to minimize the burden of flu. And as we've talked about, the masks, the social distancing is going to help to flatten that curve already. But keep in mind also that we got our cold front a little bit early this year in Colorado. We've already had our first snow. And there is good data from Sweden, from the Journal of Clinical Virology, that the first cold front really ushers in the flu season. And that's happened 3 years in a row in this nationwide study from Sweden. So it is possible that our flu season may come slightly early this year. So we really all have to do our part in order to minimize the burden, not just on our healthcare system, but also on our family and friends and on ourselves.
Yeah, so get that flu vaccine and at least reduce your chances somewhat. Dr. Cheshire, we talked about the safety of going to get a flu shot, but talk about the vaccine itself. Is the vaccine safe?
Yes, the vaccine is safe. I think we've touched on some of those cases, and we've seen it, right? I've seen it where I've personally given patients the flu vaccine, and 2 weeks later, yes, I've done a swab and they have the flu. And we as humans, right, we want to have categorized explanations. We want to say, I got the flu shot and now I got the flu. So while that has happened, and while it can happen, how do we explain that? What's going on? We know that the flu shot itself, as Dr. Coley has said, can cause some mild, low fevers, body aches, and that's the immune response. It's not you developing the flu after the shot, which is that those feelings, those should be comforting. That's an immune response that may protect you against other things, including the flu. So how do we explain when people got the flu shot and are truly diagnosed with the flu? So I think we've talked, Nikki mentioned, sometimes we don't get it quite right with the strains, or they've mutated by the time they've landed in the United States from the Southern Hemisphere. The other explanation is that 2-week lag time. So someone could have either been infected with the flu when they went to get the shot and may have not have manifested symptoms at the time they're receiving the vaccine, or they're in that 2-week time period where they're waiting for their body to develop immunity and they contract the flu at that point. So that's the explanation that could be going on there. For those folks that maybe got the flu shot and then associate, maybe it wasn't the flu, but got really sick with a cold, cough, more than just generalized side effects from the flu shot, probably were infected with another virus at that time. So rhinovirus or common cold or any of the other multitude of respiratory viruses. So yeah, it can't cause the flu, minus what we've spoken about, the flu miss in some of those populations. Immunocompromised wouldn't be recommended for those folks, but yeah, it's safe and important, and absolutely fewer side effects, shorter duration than the flu itself.
And Janet just asked on Facebook, we just talked about this, Nikki, but she said, sorry, I just joined in. I'm immunocompromised, 50 to 60 years of age. Is there a specific flu vaccine I should be asking for? So can you address that again? If someone's 50 to 60, what specific vaccine should they ask for?
Sure. You can get the quadrivalent Fluarix or what's called the flu block, which really has that adjuvant for those who are 50 to 64 years of age. And that would be the one that I would be recommending.
Okay, and before we go, I want to just mention again that 9Health will be providing free flu shots at our fall 9Health fairs. Online registration just opened yesterday. We had to cancel the spring 9Health fairs, obviously due to COVID-19, but we're able to take some safety precautions and offer a handful of fairs this fall. And you can get a free flu shot or a voucher for a free flu shot to, I can't say that, it's like a tongue twister, free flu shot to take to Safeway and Albertsons. You have to make an appointment at these 9Health fairs, so make sure you do that. Again, go to 9healthfair.org. But you can go safely, get your blood work done, and get your flu shot at the same time. And Dr. Cheshire, the CU College of Nursing is also offering drive-up flu shots this fall. Can you talk a little bit about that?
Sure. Many of the same precautions during this twindemic. It's drive-up, curbside. We'll also have a tent available outside for folks that use public transportation and don't have access to a vehicle. Appointment only. And yeah, and with ours, we accept most insurance plans, and it is a preventive service required under the Affordable Care Act to be covered by most people's insurance. Occasionally, people's insurance will dictate where you can get that flu shot if you're going to run it through your insurance. So that'd be an important piece to let people know, to make sure that if you're using your insurance, you contact your insurance to make sure that there's not a specific place you're required to go. But I can also have a website and information to share.
Yes, and she sent me that, so I'll put it in the comments right when I get off here, and you guys can access that as well as 9healthfair.org to sign up for health fairs. Nikki, you mentioned before we came on that Safeway Albertsons will have drive-up flu shots as well. Can someone take the voucher they get at a 9 Health Fair and then go to that drive-up?
Absolutely. So we're going to be offering drive-up flu shots for the next 5 weeks. Tuesdays will be in Northern Colorado, Wednesdays will be in Denver Metro, and Thursdays will be in the Colorado Springs and Pueblo area. If you go to driveupflushots.com, you can see all of our dates and times. But yes, you can use your voucher from one of the 9 health fairs there. And again, these are designed just so that individuals who are immunocompromised, have a medical condition, or maybe just don't feel comfortable going into a public space right now to get their flu shot. They're fast, convenient, professional, as well as no appointment necessary. So 11 to 1 on each of these, but you can find those at driveupflushots.com.
Great, and I'll put that link in the comments as well. I just added the one for the CU Nursing drive-up flu shots. I'll put in the 9healthfair.org link, and then the one that that Nikki just mentioned as well. Yeah, before we go, I mentioned the 9 health fairs, and then also if you have a health question about the flu shot, COVID-19, flu in general, any health question, mental health question, you can call our 9 Health Neighbors line still, 303-698-4455, extension 2005, and a 9 Health medical volunteer will call you back within 24 hours. You can talk to a real person and get your questions answered. It's a nice buffer between having to call your doctor or go to the doctor. And we are still running that. So even though we're having health fairs start up, we will still have medical volunteers answering those calls. I want to thank all these ladies for joining me today, and we're going to sign off for here. Thanks so much.
Thank you.